For those of you that are not aware, my name is Dr. Timothy Barker. Today, we're looking forward to a really exciting webinar looking at collaboration and communication in evidence-based healthcare. Now, there have been increasing global efforts to include research from all income levels in developing evidence synthesis methods, enhancing capacity and strengthening knowledge translation channels. In this webinar, we are focusing on the Global Evidence Synthesis Initiative, their work with evidence synthesis centers in low to middle income countries, and the potential opportunity that open synthesis brings and how collaborations across the globe and disciplines can support the use of evidence synthesis products in decision-making. Now, we are JBI, and JBI headquarters are based in Adelaide, and we acknowledge that today we are meeting on the traditional country of the Kaurna people of the Adelaide Plains, and we pay respect to their elders past and present. We recognise and respect their cultural heritage, beliefs, and relationships with the land, and we acknowledge that they are of continuing importance to the Kaurna people living today. We also extend that respect to other Aboriginal language groups and other First Nations. So, one final thing before I introduce Tamara, if you do want to tweet about this webinar, or if you do want to engage through social media, please use our hashtag JBI Live, and you can tag JBI Evidence-Based Healthcare at JBI EBHC, or either Tamara or myself. So, without further ado, I want to introduce Dr. Tamara Lotfi. So Tamara is a medical doctor and a public health practitioner. She is a research associate and a project coordinator at the WHO Collaborating Center for Infectious Diseases. She's research methods and recommendations at the Department of Health Research Methods at McMaster University in Canada. She co-leads the eCovid-19 RecMap and coordinates the WHO ETB RecMap. She is currently completing her first year of the PhD program in health research methods at McMaster. She was previously the coordinator for the Global Evidence Synthesis Initiative, Secretariat, where she leads the GESI Network of 47 centers from 25 LMICs. So, Tamara, welcome.
Thank you, Tim. Thank you for this introduction, and thank you, Danielle and Zach, for this invite and for including me in the JBI Live webinar series. If it's okay with you, I'd like to share my slides. So hi, everyone. Good morning to everyone in Australia. Good afternoon. So thanks for joining. I'm very happy to be here today. Just quickly disclosures, and I think Tim actually covered my affiliations. So to start with, today we'll be talking about collaboration, communication, open syntheses. I am very aware that many of you have actually some more expertise in some of the topics I'll be covering, so please feel free to chip in and add anything that I might have missed that could be useful for our attendees. To say that mainly the purpose of talking about collaboration, communication, and open synthesis is to see what role they play specifically in evidence synthesis. And I've chosen the image of multiple triangles within one triangle for evidence synthesis, just to say that evidence synthesis is a multi-dimensional process. We're used to the pyramid with the different levels based on the level of evidence, but really there are multiple dimensions there to get evidence synthesis to do its optimal, the optimal work it was designed to do. So to start with, I just had a few refresher points for what evidence synthesis is, just for those who are not familiar or for those who have not read the definition recently. So evidence synthesis is our method that we follow to capture all relevant information on the research question. It allows us to identify gaps in knowledge, to establish an evidence base for best practice guidance, and to help inform policymakers and practitioners. There are different types of evidence syntheses, and I specifically chose this table that actually shows the different types compared to one particular type, which is a systematic review. Why systematic review? Because systematic review is the mostly used in healthcare, in medicine and nursing and so on. And in this table, in their work, et al. Have done the comparison to see the different types of evidence syntheses, their shortfalls, and their added values. So in particular, we're comparing, for example, scoping reviews to systematic reviews. Systematic reviews were initially put together to provide a higher level of evidence when responding to a certain specific research question, but the shortfall there was that their scope was too narrow, and scoping reviews came to light to answer that by broadening the scope with broader eligibility criteria. However, scoping reviews themselves would have their own shortfalls, such as they don't include critical appraisal necessarily, they would only narratively synthesize the findings, and they are time and money consuming at a time where the same resources could have been used to generate higher evidence level using systematic reviews. Another example would be living reviews, where they are there to replace systematic reviews that could run out of date and that would need update even if no studies are available. And then living reviews would partake continual updates and are time efficient. However, living reviews are also of narrow scope and costly and time consuming. So just to say, there are different types of evidence syntheses. There are different shortfalls. We don't have yet the ideal evidence synthesis products. Very important method. It's important to clarify that for each question, its own type of evidence synthesis, for each setting, for each component. So there are many factors to consider what type we want to use. But the keynote for today is that in all of these types of evidence syntheses, there is room for improvement, and collaboration itself could actually play a big role in answering these shortfalls. So I'm taking the example of a systematic review in particular, and the steps for conducting a systematic review. I put them here in 10 steps. One could change or modify the number of steps, but the gist is the same. So to conduct a systematic review, we would start with specifying the PICO question. For those who are not familiar with PICO, PICO is formed from the 4 components: population, intervention, comparison, and outcome. And we typically use this format in a systematic review of intervention studies to set our research question very clearly. There's room there for collaboration or enhancement of a certain PICO question when collaborating with others. For example, in the COVID-19, in particular pandemic, when the research questions for COVID-19 were getting started to be out there, when priorities are set, when different stakeholders are asking different questions, being able to collaborate with other researchers in different settings, with other researchers who have access to different data, actually helped a lot of these PICO questions to be edited, to be narrowed, to be worked in a way that could actually lead to beneficial answers that could actually be searched for, that could actually be addressed by systematic reviews, for example. Another step that could definitely benefit from collaboration would be writing a protocol. So as any other evidence synthesis product, a protocol is a must, as it stresses on the importance of transparency in the work, reduction of bias. And so collaborating at the level of protocol write-up actually allows room for any enhancement that needs to be done in the process that's projected, to account for any challenges that might come up. Different experts could have different expertise in certain challenges that could come up, and one could have missed them when writing up their protocol. And so there's a very big added value for collaborating from the beginning when conducting systematic review, for example, or any other evidence synthesis product, and preparing for the work. One more example I'll give is the collaborations, importance of collaborations when submitting for publication. So we've all been through that phase where we've done all the work, we have the piece of the manuscript ready for publication, but then especially in low-income countries, getting the paper accepted in big journals, in relevant journals, and high impact factor journals could be very challenging. And collaborations have proven, and especially interinstitutional global collaborations have proven that there's higher chance of for a paper to be accepted when certain institutions, for example, are represented within the author's affiliations. So collaborations could be beneficial at the different levels of evidence synthesis production. There are many existing collaborations or networks globally that specifically focus on evidence syntheses. I mentioned a few here. So we have the Cochrane collaboration. So Cochrane, previously known as Cochrane collaboration, the Campbell collaboration, JBI, the GESI Network, 3IE, EVIPNet, COVIDend, Africa Evidence Network, Cochrane Africa, WHO Health Evidence Network, the Collaboration for Environmental Evidence, and others. And there is a huge added value there because one, there's a diversity in regional and geographical representation. Two, there's a diversity in topics and disciplines. And three, there's a diversity in terms of the type of products that each of these networks produce. And most importantly, almost all these networks actually collaborate together and actually have at least a couple members that are the same members and representing each other on the different in the different groups. So just to think of basics, what is the starter pack to starting a collaboration? One, defining what a goal for a collaboration is. For example, COVID-19 was out. It was very important for researchers across the globe to collaborate in order to be able to access data, to generate data, to work together more efficiently. And so the goal could be to specifically answer the research questions coming up on COVID-19, specifically healthcare-related questions, for example. And we've seen and we've witnessed a lot of initiatives coming to light, specifically during COVID-19, to allow international collaboration and knowledge exchange. Then we think about who's organizing it, who is going to be invited to be part of this organization, collaboration. What is the timeline for it? So is it a collaboration that is here to stay? Is it a collaboration that will grow if it is supported? Is it strictly here to answer a certain emergency, be it a certain disaster or COVID-19, again, the pandemic, or a conflict and so on? How is the centralization of the efforts going to be? Is it going to follow a secretariat format? Is there going to be a pre-established model in which the current collaboration that we're starting will just take part of it and then disappear, or will it create its own subgroup and secretariat and so on? What is the funding for it? Does it need any funding? Where is the funding going to come from? Are the funders interested in funding a collaboration versus one single center? So these are very important things to consider before collaborating with other centers. Will there be any membership fees for the members that will join this collaboration or the network? And here we think about the differences between professional societies, open networks, or voluntary initiated initiatives. And last but not least, the benefits of the members. So what will the members of this collaboration benefit? Is it really, is my institution inviting another institution to collaborate because of joint and mutual benefits? Or is there something specific that we are seeing as a main goal, and then the other member would have to also impose or suggest what actually works for them to make this collaboration successful? So what could be the role of collaboration in evidence synthesis and making evidence synthesis efforts work, in making evidence synthesis products used by different stakeholders? One, collaboration allows access to metadata, if not larger metadata. Two, it allows skills exchange. And the skills exchange could be based on expertise and so on, but mainly it could also be based on location, specifically when the research is setting specific. And in that we mentioned, for example, conflicts and disasters. And so in the time, for example, back when I was based in Beirut, where the GESI Secretariat was based, when the conflict was in the region, a lot of researchers globally were interested in collaborating specifically with departments at the American University of Beirut, because the American University of Beirut is located as close to the disaster as is needed and has the resources to do the research on the ground. But then international collaborations would have the funding for it, would have the support to get the work published, and so on. And so that collaboration was strictly successful because of the capacity to exchange skills. Additionally, within collaborations, different players would become aware of different online collaborative tools and virtual workspaces. Specifically, we've seen that in COVID-19 and the pandemic and the work from home. Many of our collaborators would only meet in international conferences, for example, but due to the stay-at-home order globally, new tools emerged, and the concept of virtual workspaces became actually possible. And we've seen a lot of increase in the production of research and evidence synthesis. In addition to that, there's a big role in research exchange, specifically in challenging times. So in addition to skills exchange, in addition to tools, there's also different other types of resources. For example, access to different databases, access to different tools to conduct evidence syntheses, to do analysis, and so on. And last but not least, the timely identification of evidence as it emerges. And this is very specific, for example, to the context of COVID-19, when those who were able to collaborate with Chinese researchers at the time where data was strictly limited to that region or that country, for example, they were aware of when the next RCT or the next study is going to be published to include it then in their evidence synthesis piece and to keep their evidence synthesis piece as relevant as possible. And so now I'll be moving to talk about two main collaborations and networks that I've been part of, that I've contributed to. And the first one is the Global Evidence Synthesis Initiative. So the Global Evidence Synthesis Initiative, GESI, was launched in 2016. It is a collaborative effort. It came together after many discussions that started in 2012. There were different stakeholders engaged in the thinking, the conceptualization, and making it happen, actually. And the way it is that it's different organizations that have contributed majorly globally to the development of methods and the production of evidence synthesis in health and other fields that came together to see how we could enhance the capacity in low and middle income countries for the production and use of evidence synthesis. And so they called it the Global Evidence Synthesis Initiative. It was mainly funded by Cochrane, the Alliance for Health Policy and Systems Research at WHO, the American Institutes for Research, and the International Initiative for Impact Evaluation. And then it was also governed, in addition to these, by Campbell Collaboration, by the Collaboration for Environmental Evidence, the Joanna Briggs Institute, and the EPI Center. And so these organizations came together. The American University of Beirut was chosen to host the Secretariat for GESI in Lebanon. And it has been functional since then. And so in order to achieve its goals, in order to enhance the capacity in low and middle income countries, GESI Secretariat launched a call for a GESI network where 46 centers from 24 low middle income countries were accepted based on specific eligibility criteria, which were that the center or the research center should be based in a low middle income country, in an institution that is not for profit, and to have published at least 2 systematic reviews. Or we actually, the eligibility criteria were not limited to systematic reviews. We actually included centers that published any type of evidence synthesis or policy briefs. And so the achievements that the Secretariat, that the GESI in general was able to achieve was forming the GESI network, was conducting multiple capacity building activities through webinars, through workshops, locally in Beirut, but also at all the international conferences that GESI was able to attend. A needs assessment that looked at what the existing capacity of the different centers were in terms of conducting evidence synthesis, collaborating locally with stakeholders, policymakers, locally with other centers from the GESI network, regionally with other centers from the network and other networks, and their capacity to partake and uptake evidence syntheses to inform policymaking. In addition to that, the GESI was able to work on 3 evidence synthesis products in which the network, the 47 centers were invited to partake, and it was a collaborative effort to put together 3 evidence synthesis pieces. One that looked at interventions intended to enhance self-reliance of refugees and internally displaced persons. The other being a systematic map and critical appraisal of systematic views on conflict and war. And the last one being a systematic review of business models for research centers. So how did GESI succeed in enhancing low-middle income representation? First, by involving the GESI network in the update of the Cochrane Handbook. And this was the first time where low-middle income countries, authors specifically, were invited to contribute to the Cochrane Handbook. Second, by involving the GESI network members in international conferences, such as Campbell UNICEF MegaMap launch, where we were able to get GESI network members to be invited to attend there and participate in the launch. Third, by getting involved in the discussion and inviting different GESI network members to partake in discussions with the International Network for Patient and Public Involvement and Engagement in Health and Social Care Research. Fourth, by collaborating with the Stockholm Environmental Institute on capacity strengthening in systematic reviews related to environmental management and on putting together grant applications for systematic maps and systematic reviews. So the models for partnerships that we used, one within the GESI network, first starting with acknowledging the existence of centers. Many of these centers had been working out there way before we had started working. Many of them were well connected, well established, and had received the training by multiple globally known organizations. Second, by providing a platform to showcase experience and ongoing projects. For example, through our webinars, we had 2 different webinar series, one that was specifically allocated for our network members to present the work they're doing. And then by providing a platform to exchange opportunities for funding projects and mentorship. And so also through our webinar series, we invited whoever was coming with an opportunity, whether it's an opportunity to apply on a joint grant application, whether it's an opportunity to present globally or to share current work. So we also provided a platform for that and for support using available resources. So for example, we also invited our network members to use our own tools to conduct the webinar series to do their own sessions. So for example, when they had lectures or webinars they would want to do locally or regionally, they were able to use our the GESI platforms, but also we were playing a major role in disseminating that. And of course, we've used the GESI social media to increase access to different conferences. For example, when we were able to attend a conference, we used our social media to live stream the sessions that were relevant so that the network members could also partake. Partnerships with other networks. So first, by identifying existing networks. Second, by collaborating to achieve common goals. So for example, the Africa Evidence Network, Cochrane Africa, the collaboration for environmental evidence in Southeast Asia, and ICDDRB in Bangladesh. And then third, by reaching out for and disseminating opportunities externally and a lot of knowledge exchange with other networks. So what were the success factors for the GESI network and GESI in general? First, the active representation. We were very active. We did not miss an opportunity as much as I'm aware. At any conference that you've seen us, you've probably seen us running around attending at least all the possible presentations that we could. And every time we were able to present, we would mention the GESI network members. We would stress on the importance of going to our website, because on our website, we provided a description of each of the network members to enhance their visibility. Second, we had a model where we had an executive team, a secretariat, and a governance group, and these 3 were able to make decisions together, to implement, to take action, to respond to needs, and to continuously look for opportunities for the GESI network. Third, by engaging the network in planning and implementation. And so we've had at least one meeting every 6 months, with the network, but also we've had smaller group meetings with network members in the same region. And that was very helpful to make sure that the network members are engaged in the planning and implementation. 4, we focused on increasing visibility of members and identification of opportunities. 5, the joint grant applications. 6, the knowledge exchange through regular webinars, meetings at international conferences, close follow-up with members. And 7, and most importantly, we were able to run on a very low budget. So the second example I'd like to talk about today is the eCOVID-19 Living Recommendations Map and Gateway to Contextualization. And this is one of the projects I'm currently working on. I'm a co-lead on that. And it's a collaboration between a very large number of members. We have a lot of organizations on board. JBI, of course, is one of them. And as you see, we have geographical dissemination, we have diversity in expertise. The purpose of this group coming together was to develop a living recommendations map, which was a first of COVID-19 recommendations. And it was definitely highlighted by the need to have all the COVID-19 recommendations in one place for different types of users. So we had already done similar work with WHO TB department, and this was the first multi-institutional that was that had so many institutions that was working together for a recommendations map, a living recommendations map. And so what we worked on was to capture all published guidelines on COVID-19, get our team to extract information, to appraise the guidelines and present the recommendations in those guidelines on a map format. Very similar to, you could see it as similar to the living evidence maps, but these were the first recommendation maps. And so in times of COVID, as you can expect, these were of high importance and much needed, especially when multiple guidance were being published. And what users can do through our map is to access a certain recommendation by choosing the intent they're looking into, they're interested in. So let's say it's prevention, and then looking at the population and intervention, finding a recommendation that answers their question of interest. Next to the recommendation text, we'd provide the certainty of the evidence as it was reported by the developers, the strength of the recommendation, and then we provide the appraisal by our team using agreed to score. And most importantly, we would link to living evidence map platforms. And this was possible because of our collaboration with, for example, Love from Epistemonicus and the Norwegian Institute for Public Health, the NIPH, who also were leading their own, living evidence map. The work that we've done with the eCOVID recommendations is only increasing and getting more and more attention. So we moved from strictly capturing, extracting, appraising to also adding to that a lot of linkages to other platforms. We also now have plain language recommendations to allow different users to be able to relate to the recommendations, to understand what exactly the recommendation is requesting. We also now provide expert opinions by experts from our team, and many success factors were there, but I'll just mention 7 of them that actually allowed us to succeed with our eCOVID recommendations map. And actually, we're able to plan for upcoming steps that also require collaboration. Mainly, the main success factor was that our team, our leadership team, was initially very well connected. Second, the coordination was taking place centrally. Third, we had mainly an executive committee and working groups in place, and these all had defined roles and were working together collaboratively in a very structured manner. We had regular meetings, still having regular meetings, and we have very clear communication channels within and between the different working groups. A very dynamic collaboration, so we keep updating the work that we're doing, adding components such as, for example, the plain language recommendations right now. We have a development option through the map where users can request to actually adapt a certain recommendation using GradePro from our map directly, and they will be guided to do the process just by submitting a very short form on the map. And last but not least, the dissemination. We were able to disseminate our work to attract visibility through social media and so on, which also allowed us to do replication work where certain institutions requested to actually collaborate to replicate the same format of that map to topics and work, to topics of their interest and work that they have been leading on. So just another example of collaborations that worked in time of COVID-19. And this is when evidence synthesis made it to the media originally last year, if you remember, very early in the pandemic. Wearing masks was a very big question. It was very controversial in some regions and so on, but the evidence synthesis to impact policy, but also to make it to the media. And we've had users starting to understand that there are different types of study designs out there, different levels of evidence, and that the different types of evidence actually affect what kind of decision they need to make, what they need to change in their behavior, and so on. So very quickly on communication, before moving finally to open syntheses, just to say that communication is of particular importance, because whether it's at an internal level or within a collaboration, it actually, if we have a good communication channel or pathway, it increases interaction. And we have increased interaction directly when we start a collaboration or we start working with another person. And so there's a need for adequate communication channel or more whenever we're conducting collaborative work, specifically in evidence syntheses. And to keep in mind that different settings would have different infrastructures, which affects technically the communication channels that we would be using. And so it's very important to identify common communication tools that could be used by different stakeholders, by different members of a collaboration, and then ensure that there are equal resources required. So if one of the collaborators is accessing certain resources for free and the other actually has to go out of their way to allocate certain funds for that, maybe it's not the ideal communication tool to use, but better to look for something else. There are different tools out there for systematic reviews, for evidence synthesis in general. There are different tools to communicate between researchers. So always good to look into it before choosing your communication tool, and then testing the communication channels. And last but not least, we'd encourage the dissemination of whether it was successful or not when you've used a certain communication tool within your evidence synthesis project. So the last point I'll be covering today, and I think we're still okay on time, is open syntheses. And if you're familiar with open science and the concepts of open science, should be probably familiar, or you could relate to what we're trying to say here. And so to start with, I'd start with open collaboration. And here in this figure, this is from the work that Neil Hadaway et al. Have done on open synthesis, specifically in times of COVID. And so we're talking here about, if we start from open collaboration, for example, we're saying that there's non-selective opportunities for collaboration in ongoing systematic reviews on maps. We'd move then to open discovery, where it's free to use search facilities for bibliographic data. And this was very important in times of COVID, as you can imagine, where, you know, not everyone has access, just like any other times, not everyone has access to the same bibliographical data. And then open methods, so freely accessible, detailed methods for systematic reviews and systematic maps. And so I've had also one comment here, which was related to Prospero and to how Prospero makes it easy to learn about what others are doing in terms of certain methods, and keeping the information on those methods out there and shared, so that one could account for them when doing their own work. Open data, freely accessible, well-documented research data from systematic reviews and maps. And this was very well highlighted also during COVID-19. And especially, for example, the Epistemonicus COVID-19 collection archives data extracted from within reviews in a publicly accessible database. Then there's open source, where it's freely accessible, repeatable programmatic code for all software used in systematic reviews and maps. Going to open code, freely accessible, repeatable code for all analysis conducted within systematic reviews and maps. Going to open access, free to access manuscripts of systematic reviews and maps. Moving to open peer review, freely accessible peer review reports, responses, and versioning from published systematic reviews and maps. To open education with freely accessible and usable training materials relevant to systematic reviews and mapped conduct. And going back to open collaboration, or to say that there's open interest in the middle with transparent declaration of all relevant financial and non-financial interests. So this is mainly what I have planned to talk about for open synthesis, but I hope you see the importance here of covering the different steps of an evidence synthesis within a collaboration, the role that a collaboration would play, the importance of the good communication tool, but also keeping every step open. And in particular, if you're interested in open syntheses, there's an open synthesis working group that Neil Hadaway and myself run. And if you're interested in joining that, we'd be very happy to also have you on board. So last but not least, and this was actually triggered by a certain question that I received earlier this week. And it's just to say that there are different ways to build capacity and strengthen capacity for evidence syntheses, and those would have different indicators for success. So is networking actually one of the indicators for successful evidence synthesis capacity strengthening? And so if we're considering that capacity strengthening is what we're interested in, and that it goes through a monitoring and evaluation process, learning and development, and then it addresses gaps, and that this capacity strengthening could actually benefit from collaborating or networking. This networking could actually be institutional, geographical, local or regional, professional societies, networking with funders, and so on. And so if we actually put the stakeholders, the 12 types of Ps that could actually be involved, and then look at how we can move from capacity strengthening to addressing gaps, but also networking on the different levels of the work that we do, but also learn from the different stakeholders, what questions they have on the ground, we can definitely see that there will be a joint benefit. There would be mutual benefit for growth, for finding solutions to practice questions, but also hopefully to get the research work that's planned to have higher chances for being funded, for example, but also to being used by the public or by the patient advocates, or by the different stakeholders that could be engaged and could be interested in a certain research question. So to end here with stakeholder engagement, if you are interested in more on stakeholder engagement, follow the multi-stakeholder engagement muse, engaging patients and other non-researchers in health research is one of their papers. There's different work that's being done, and that could be very beneficial. My last slide is on food for thought. Do funders prefer funding networks, partnerships versus single centers? Who is keeping track of goals and priorities within a collaboration, and how are we harmonizing these? Otherwise, just some acknowledgement to the different teams I have been lucky to work with and whose work have helped me bring together these slides today. And I'm happy to share the resources.
Yes, thank you very much, Tamara, for that wonderful, wonderful presentation. I'm just bringing up my slides now. Now questions were coming in thick and fast, and we got many in the end, so I don't know if we'll get to all of them, but I'll start with this one. So how important is the role of technology in collaboration, and has COVID shown us that we don't need to meet up in person?
It's a very interesting question. I'm sure we all would like some data to answer that question. We've witnessed a very big increase in, I mean, as researchers, if what is better production, right? Are we looking at the number of published research? Are we looking at research that actually impacted the practice or made change possible? So we definitely, these are the right questions, right, that we're all asking. Are we able to really just move out of office to all move to a virtual working? It's a good question, right?
Yeah, well, we'll stay on that COVID theme. This is a question from the chat. What strategies have you used to keep network members engaged, especially during COVID?
So it has been a major challenge during COVID because different network members from different countries and regions were facing different challenges. The lockdown measures were taking place at different times. The access to internet, the very basic concept of access to infrastructure, to the internet at home, was very diverse. We've lost contact with certain network members for 2 months straight, and that's not something typical, right? So we've learned a lot. We definitely have learned a lot during COVID-19, and we are all still looking into what's going to be feasible moving on. But there is commitment, and that's the key for a successful network. There's commitment from members to come back and let us know that they are back. For example, they are available, they are capable, or that they simply have had to miss any opportunity for collaboration during COVID-19 because of their life engagements simply. Yeah.
Okay, yeah. I actually think that also answers the next question I was going to ask, which was how can we ensure long-term collaboration in the face of funding difficulties? But I imagine many of the same strategies that you just mentioned could be employed. So we have another question. Can you tell us a bit more about the Open Synthesis Network you're involved in, and what are the aims? And can anyone join?
Sure. So the Open Synthesis Working Group was initially launched by Neil Hadaway and myself. And the purpose of it is to work together to define the concept of open synthesis, the different the components of it, how to make it feasible. If it works, how can we make it work? What are the limitations? Can we all work on these limitations or not? And so on. And it's really, of course, inspired by the open science concept. And the reason why it came together is because we're doing all these things in systematic reviews and evidence syntheses, but we also are very aware of challenges and limitations that are specifically being brought in due to resources that could be simply shared, be it coding, be it programming, be it tools, be it databases. And for example, I'd mention in one of the systematic reviews that, in one of the evidence maps that the GESI Network was leading on, we were collaborating with one center that is based in the Paho region, which allowed them to translate our search strategy, adapt it, and run it in their local and regional databases to capture evidence that's published in non-English language in Spanish, and then do their own process of going through the evidence, selecting, appraising, and extracting, and having that as part of the work that we're doing. And that could not have been possible if we, for example, did not share our search strategy, if we did not make it available as part of our collaboration, right? So we are interested in pushing it forward. Everyone is invited to join. Just feel free to drop me an email and we'd be happy to send you what's out there already. So there's one paper that is out there specifically talking about open synthesis and COVID-19. Yeah, and we'd be happy to have more people on.
Okay, and of course, we can provide some contact details for Tamara as well. Now we have another question. How can we improve the capacity of researchers to network and collaborate? It seems to be a forgotten role, and there seems to be little training in this regard.
Definitely, very good point. So I'm not sure if any of us was ever trained on networking, right? It simply came as part of the job. I was very lucky to work with people who are leaders, who are mentors, who are well connected, who open opportunities for me as a junior researcher to get to where I am today. And that has increased my capacity to network, to meet, to learn, and develop. And similarly, this is what we try to replicate within our network, be it the GESI network or my current work with the COVID-19 recommendations map, for example, and the different work that we're doing. Having that model of enhancing capacity throughout a team across a collaboration, and also, for example, exchange of leadership. So if one of the things that we focused on within GESI network in low-income countries is that when a junior researcher or a student in one research center is looking for a certain senior expertise to supervise on a PhD topic or so on, we'd identify someone from the network in another institution that could do that. And so we'd have this sort of skills exchange and task exchange and so on. And that definitely helps with networking, of course.
Okay, now we've got just two more questions, I think. So the second to last one is open evidence synthesis feasible and achievable? What needs to change to achieve open synthesis, or what barriers need to be overcome? For example, publication models, authors' attitudes, funding models, etc.
All of these, plus many others. So there's a lot to be changed. The important thing, the key thing is to start the discussion, to start getting it out there. Publishers have a major role. I am very confident that publishers have a major role in pushing for open syntheses. Similarly, researchers themselves, research center leaders, trainers, and anyone who's involved in evidence synthesis. So all these points are legit. These are all, there's a list of barriers that need to be overcome, and we need to go through them one by one. So again, if anyone's interested to join, you're welcome to join and help us get this done.
All right, and our last question. You've touched on the different communication tools, infrastructure, and channels required to facilitate collaboration within and outside of networks. What are the other key resources and inputs that ensure collaboration is successful and it achieves its goals?
Sure, that's a great point. So first, resources, and that be it financial or human resources. And we've actually are finalizing our GESI needs assessment paper that talks about the different needs within the GESI network, so low-income countries and so on, for making evidence synthesis successful, but also these apply to collaboration. So having funding to support a collaboration that requires physical presence, that requires use of tools online and so on. Second, having mutual interest in sustaining this collaboration. Third, having of course joint priorities, having established a set of priorities that would be addressed by evidence synthesis that are joint. So for example, the SDGs, right? So many collaborations have come to light to answer certain SDG topics because some of them were shared goals. In addition to that, there's the maintaining researchers. So we've seen many collaborations that would fall apart because in one of the centers, the lead PI is no longer there, the junior researchers are no longer there, are looking out for different opportunities to grow and so on. And so the team that's mainly leading on one side of the collaboration is no longer there. So many factors could actually work for or against making a collaboration successful. But the important thing is, and it's one of the things I think that I've mentioned before, is to know what the goals are, define the time that is set to achieve these goals, and to make sure that there's alignment there in terms of the activities, in terms of the expected goals, and in terms of the purpose of the collaboration itself.
Alrighty, so I've just had, like, I can just see a few more questions come in. So we've got the time. So with open synthesis, how do you move and encourage people to make research freely accessible?
Well, in many times, so my colleague Neil Haddow is actually very active on this. We repeatedly try to contact authors. We try to make, we try to make comments here and there on Twitter. Mainly, you probably have seen Neil very active in doing that. We also, when we're working with any group, we are always preaching or trying to get the open access option. That's the first thing. The second, Neil has led on multiple evidence synthesis hackathons where they've developed multiple resources for conducting evidence syntheses that are open source, open coding, and so on. So these have been very successful, one, in actually allowing room for innovation, and two, in ensuring that people are encouraged to use open source, open coding, and so on. And then three, we try to get our own research freely accessible, open access, and hopefully that also encourages others to do the same.
Alrighty. And the final question that has just popped in, with your experience in establishing and working with a number of different evidence networks with different purposes and goals, what is your key takeaway on the role and value of evidence networks in promoting and supporting evidence-informed decision-making?
Great question. Thank you for that. It is really impressive what a group of evidence synthesis researchers can do. And it's not just about putting together a piece of evidence synthesis, it's actually getting it used. It's actually answering a need. It's actually answering a decision maker's question, but also it's pushing the agenda, pushing decision makers to ask different questions. And as part of collaborating with different disciplines and different networks, if we're actually considering collaborating with different stakeholders in conducting evidence synthesis, we are actually technically considering training different stakeholders, understanding and using and developing evidence syntheses. There's a major added value there if everyone is on the table in the development of an evidence synthesis piece. There's higher awareness of what is evidence, there's higher awareness of where am I going to find an answer for my question, and there's higher awareness of what decision I am going to be making today and for who I am going to be making it, right? So the experience I've had with the different networks is that collaborations work. If you have the right people on the team, if you have the efficient goals set from the beginning, if you have aligned goals, if you have resources available, even if the resources are not ideal, if the joint goal is that important, evidence synthesis networks, in my opinion, have succeeded. We already have the concept of evidence synthesis out there, and we've seen a lot of progress during COVID-19. We've seen people progress from strictly citing a single case study to actually looking for what the best available evidence is there. And the media, again, the media taking into consideration evidence synthesis itself is a huge success, right? So I think evidence synthesis methodologists and researchers have the power to make a lot of change possible. Always good to pay attention to not duplicating each other's work. It completely defeats the purpose of evidence synthesis. And so joint agendas, aligned priorities, and collaborative work, I think that would be the right cocktail for it.
Righty, wonderful. Thank you very much, Tamara, and thank you for taking the time to present to us today on your extremely interesting topic about collaboration, and for taking the time to answer all these questions.
Very nice.
We really do appreciate it. Now, before I close this webinar, I just want to do a little bit of announcements. So our next webinar is going to be on the 8th of September. With Dr. Lucilyn Lizarondo and Dr. Cindy Stern on integrating quantitative and qualitative evidence in systematic reviews through the mixed method systematic reviews. So these systematic reviews are becoming increasingly popular, and we are going to get an excellent presentation about how we can do these systematic reviews and how we can use the data from them. So hopefully we will see you at our next webinar on the 8th of September with Dr. Lucy Liz Rondo and Dr. Cindy Stern. Thank you for joining us for our webinar today. For future information on JBI and our offerings, please do visit jbi.global. All of our webinars, including Tamara's, will be available on our JBI YouTube channel. It will take maybe a week or so before Tamara's is available. Once we close the webinar, you will be asked a short evaluation link. If you could just fill that out, that would be wonderful. And if you have any other feedback about the webinar today, please do contact jbieducation@adelaide.edu.au. Thank you, everybody.
Thank you.